Kelly, how's it going today?
Great. Steve, how are you?
Good. Well, thanks for joining us. We're super excited about Wello, and we're really excited about the partnership. So I'm only going to ask probably about 6 or 7 questions, and then we'll just kind of hear the story and get some answers, and hopefully there's a lot of value for our advisors that are listening. And I think we have some HR folks on the line too, so hopefully there's value for everyone and they can learn a little bit more about Wello, and then hopefully we'll get some sales out of it too.
I agree. Thanks for having me. We're really excited to share the Wello story with everybody that's online today with you.
Awesome. Okay, well, just to start, wondering if we could get a little bit of the history on Wello.
Sure. Wello comes from a long history, actually, when you think about it, because it started 40 years ago when we started the first executive medical company in Canada. And so for the last 40 years, we've been engaged in corporate health and wellness at a very high level for executives, and then more into employee basis. And we've actually won 2 national awards in employee health and wellness. So we're pretty confident we know what we're doing in this space. And so Wello actually came out of our innovation lab, which we created at INLIV 2 years ago, and looked at how can we help solve the crisis in the healthcare system, and how can we make access to healthcare easier for employees and do it in a timely way that's really comfortable and convenient for them. So that's where Wello came from.
That's very awesome. So in generally speaking, if you had to describe it to someone, how would you say that Wello, how does it work?
So Wello is what we call a virtual healthcare product, where you give us the employees of an organization. We upload them into our technology platform, which is fully HIPAA compliant. So it's privacy laws, everything's covered within that. They register very easily. We send them a registration email. They click it, register, and they're ready to go into Wello. And then they can request however they want their service delivered. And we deliver it in 3 different ways. So by telephone, so we can book an appointment with one of our nurse practitioners who will talk about who the delivery system is in that, by phone, by video, or by secure chat messaging. And we can get them on with a nurse practitioner within about 15 minutes of them requesting a visit.
Cool.
It's super fast.
So I think we talked about this when we first met you, but what's the common method that they use to service?
You know, even the young people, which you think are the digitally savvy people, would want to chat or video. 80% of our people still want to pick up the phone and talk to somebody.
That's still crazy. That's cool, but that is interesting because you would just assume video chatting that would be the default, but it's actually not.
I think, you know, as technology improves and people get more comfortable doing video kind of things, I think we'll see a big shift to the video side of things. And we have now a very easy single sign-on with our technology platform. Makes it super easy to choose video versus phone. So we hope there's a shift there, because sometimes we do need to see people.
Totally.
We can't do it all just on the phone.
Right, right. And just to speak to that too, because when we first decided that we were partnering with Wello, and the first thing we did as a company is we actually signed up for it. So we got just to test it because we wanted to be the first guinea pig. And literally, once you got that email, it was under 5 minutes to set up, and you could actually have booked your first appointment. And probably even lower than that, but I'll say 5 minutes. So from a personal experience, the enrollment is really easy. As well, with our partnership, is we can do a lot of that onboarding for the company and the employees with us and Wello. So we do all of that ahead of the launch date. So basically, when they're effective, they'll get the welcome email. They go on your system, sign up, and they're ready to go within minutes.
Yeah, it's super easy,
Yeah.
and having your group and myHSA being part of this is seamless for the end user, which I think is the best thing. They don't have to think about it. It's all on their phone. They click, they're ready to go.
Right. So how do you think advisors position Wello with employers and their group benefits package?
Yeah, I think this is a really good question, because it's one of those, well, what's in it for me from the employer point of view? I think there's 2 really important things we need to look at. So one is the ROI, or the return on that investment. Is there a positive ROI by implementing a program like this? And we believe there is, because if we look at the statistics in Canada on absenteeism alone, you will see that most organizations will see about 9 days a year where people are away from a sickness-related type thing. And if we can save them half a day or even 1 day within that time period, that literally will pay for the cost of this program in a year. So that's just on the return on the investment from the dollars and cents side. But we think there's a bigger return on the VOI, or that value of this investment. And that's more about the peace of mind that we can bring to someone within 15 minutes. So they're not worried at work, whether it's about their child or themselves, and they can actually get back to being more productive quicker. So that presenteeism angle, as opposed to absenteeism, I think is equally as important, if not more so, with a program like this.
Yeah, very. And it's funny, literally yesterday, because I know we spoke a few days ago, but then yesterday, one of the advisors came to us, and they're actually positioning Wello as a benefit for their board of directors. So they asked, first, can they have an HSA with Wello? And technically, you can't have an HSA for board of directors because they're not employees, but the standalone Wello is a perfect benefit for the board. So it's kind of a unique, we hadn't even thought of that angle to be used, but it was a unique way to position Wello with the company.
I thought that was great. Board of directors having access to Wello, I think it's brilliant.
Yeah, it's cool. Yeah, really cool. So just wondering if you've got some success stories. I know we'll talk about our own personal experience with it, but always good to hear some success stories.
I would say we have quite a few success stories, and we're going to be launching a new website soon, so we'll publish some of those. But what we get anecdotally on testimonials or client experience, so that experience that people have had, they've had some phenomenal things. So simple things like we had a guy, an executive traveling to Poland, and he was in Poland, and he got there and realized he'd forgotten all his medications. And so he called Wello, and he said, I forgot all my medications. What can I do? And then the Wello nurse practitioner was able to determine what he needed, send a requisition over to him in Poland, find someone who spoke Polish here to translate it all, and get it to a pharmacy in Poland, and they filled it for him. So
wow.
He had his medication. So that's pretty cool when you look at Wello for travel.
Yeah.
This was a unique situation because we can't always fill a prescription
Yeah.
away, but we can give them what they need to know. So I think that was really important. Or the really easy ones where a child wakes up in the night with a fever, and the parents are, do I go to the hospital? Do I not go to the hospital? What do I do? And they can pick up the phone and call Wello in the middle of the night. And this particular person had, within 20 minutes, solved what this family was worried about. And everybody was calm and went back to bed.
Well, and it's funny to speak to that. My kids, they're 5 and 3. So like the minute you said that, I can totally resonate with that because we live about 30 minutes outside of the city. And you know, young parents with young kids, we, until now, because we didn't have Wello at our fingertips, we are going to emergency or coming into the children's for, you know, a sore throat or a cough, where with Wello we could have addressed that so much easier and, you know, less sleepless nights and less stress at work and everything like that. So I can totally see it from especially from a little kid standpoint, the usefulness of it.
It was awesome. The other funny story I like is this was one they used video for because the parent had a young child who had a bite, you know, like a bug bite, and they thought it was a tick. So they're worried about Lyme disease and all. They made everything kind of get blown out of proportion a little bit. So they just got on a video console, held the phone up to the bite where the child had, and they went, no, don't worry about it. It's just an easy spider bite, so you can relax. So again, peace of mind, hugely important.
Totally, yeah, for sure.
Worrying. Yeah.
And the good thing to note with that too is with Wello offered through myHSA, the employees are covered, but also their spouse and family members. So even if, for example, my wife's a teacher, she goes to Nova Scotia in the summer, she can still access it for her and the kids while I'm in Calgary working. So all family members are covered with it. So it is an important point.
Anywhere, anytime, you like to say.
Yeah.
Yeah.
So what do you think would be outcomes in running Wello in a business for a year?
Well, I would think that the big ones would be we can track utilization, so we can show an organization how frequently Wello is used, at what time of day it's used, by who it's used, by whether it was a male or a female. And we won't give them personal information,
Right.
obviously, but we can give them a lot of statistics that give them an idea of how much it actually was used and when and what for. And then we can come back to them if there's significant enough numbers and tell them what are their biggest concerns in this company that we're seeing. And then we can address that on the Keep Well side of Wello, because Wello is not just about episodic care and on getting people well. We actually want to keep people well. So if we see an organization that has maybe a lot of flu or something, we're going to come and target that organization and give them a lot more information about how to prevent flu.
Awesome, and I'm glad you brought that up because I know we've talked about in the past. So the cool thing with myHSA and Wello is as both of our companies are evolving, there's a whole bunch of synergy. So I know we've talked about it in the past, but we're going to integrate so those utilization reports, we are basically going to be fed the information and then we can post it to the plan administrator so they have access to it. And again, that's probably something that will come down the road, but I know that we've already talked about that, and the two technologies are going to work together.
Yeah.
So the reporting and stuff like that is available for the company and the plan administrator.
Data is king these days.
Yeah, for sure.
But if you can show an organization a reduction in absenteeism, potentially, an increase in productivity or attraction and retaining people, those are things that some companies are really interested in these days, and we think that these kinds of benefits, because we know that employees are not just looking for a paycheck anymore, they want to have an experience and benefits that suit personalized to what they need.
Totally.
And I think Wello really helps that.
Well, and I think too, it also helps with recruiting. Like I noticed the other day on LinkedIn is one of a senior HR person that had Wello in their offering posted a job posting, and they had the typical things, competitive salary, benefits, I think it was flexible vacation time, and then private health care through Wello.
Yeah.
So it's just one more item that HR can use to recruit and retain employees. So
we're pretty excited to see that. That's a first for sure.
It jumped out at me like right away because I'm like, that's really cool because you can see how it's almost like the advisors can put it in place for the company, but then HR can really leverage it in their recruiting strategies, in job posting. It's right there clear as day. It's an extra line that very few other HR, people are offering.
Yeah, and,
so
and the cost is like, when you look at the benefit to the actual cost, it's like, I think it's a no-brainer. You probably spend more money on pens per person than the whole cost of this program for an entire year in a family.
Totally. So as advisors come across other telemedicine offerings, how would you describe the differences between other offerings and Wello?
I think there's three sort of key points that jump out to me. One would be we are 24/7. Many are not, which I think is really important. Now, after hours, it's by telephone only. That video side of it isn't easily available, although we know the nurse practitioners have had middle-of-the-night conversations with people where they said, we really need to do this on video. Let's jump on video right now. We can transition them instantly over to video. We are using nurse practitioners as our source of delivery system as opposed to physicians. And the nurse practitioners are those super nurses in the world that are that caring, loving kind of delivery of that care that everybody really likes, but they have the capability of a physician in terms of diagnosing, treating, prescribing medications, and pretty much can order everything that a physician can. Now, you're doing this in telemedicine way, so if we have to touch you, we have to send you to someone.
Right.
That's just a given, but that's the same as a doctor would have to do as well.
Right.
And I think our 40 years of really solid healthcare delivery in the corporate space really lends us well to understanding what the client needs are.
And just to educate advisors, what are some things that a nurse practitioner can't do that a doctor can? Because I was surprised how much they actually can do.
So every province has a scope of practice for a nurse practitioner, and every province is a little bit different. So from, say, Ontario West, they can work autonomously. They don't need to have any relationship with a physician.
Oh, really?
Absolutely not. Now, from Quebec East, they do have to come under a physician at some point. So we're working on developing all those relationships, so that's not a problem.
Right.
There's also a few things in the prescribing side they can't do, and again, it's provincially based, things like opioids, and we would never prescribe that over the telephone anyway. And then from a diagnostic imaging point of view, there's a couple of provinces that restrict them from, or doing MRIs and CT scans, but most provinces let them do MRIs, CTs, just like X-rays and ultrasounds and everything.
Cool. And can Wello work with someone's family doctor?
We like to work with people's family doctors. So Wello is not a replacement for a family doctor. Wello is a supplement to a family doctor, so that we actually will send the family doctor anything that we've done with them with consent, obviously, from the employee or the family. But we want to work with them, not replace them. That's definitely our goal.
Oh, that's good to hear. So it's another value added on top of their primary care method.
Now, a lot of people in Canada don't have a primary care physician. So this is, and so what they use is walk-in clinics and emergency rooms. This is going to really help that, because we can prevent a lot of those unnecessary visits if we can catch something early.
Guilty as charged. My kids have a primary doctor, but I don't. So I'm guilty as charged. So our advisors will obviously sell complete benefit offerings, which would include EAP. Does Wello overlap EAP programs?
I like to think Wello actually is a partner in the EAP process, if you like. So we know when people are looking for an EAP or suffering from some kind of mental health concern, whether it's anxiety, depression, or something more serious, that they don't always seek out care through an EAP program necessarily, but they might seek it from a medical person, and then that medical person can actually refer to the EAP program, because what they might need is really counseling. And on the other side, if the EAP finds someone may need some care on the medical side, they can refer back to the medical side. So I see it as a synergy as opposed to an opposing thing. They really should work together.
And just because we also have an EAP offering, I almost wonder if sometime in the future that we can't bring that synergy, even if it's a buffer through myHSA.
Right.
It could be kind of a cool way to handle it, to make sure that the employee, through whatever means necessary, whatever door, that they get looked after.
And that's our goal. It's really it's about the employer, the patient from our perspective. Whatever door they come in, and they need help, we should be working together to help that person get the best care they need.
Awesome. So last question is, how would you pitch to employers the value of Wello in kind of an elevator pitch?
My elevator pitch would be that this is a very easy to add on benefit that helps the employee and their families. And it's really what we call care anywhere, anytime. So you don't have to be at work. You can use it anytime you need it. It's a very reasonable cost to implement. We can onboard an employer group very quickly and get the program up and possible. And through that, we also get great return on the investment. That ROI, VOI, I think we can measure that and show that to them in a very short period of time.
Awesome. Well, thank you so much for joining us today. What we'll do now is we'll answer some questions via chat, and then hopefully I'm sure we'll have another webinar down the road, because there's tons of things we could talk about, but thank you for joining us today.
Thank you very much for having me. It was fun.
Awesome.